feedback from it. So we thought we would keep going. We'll record this one as well, as you can probably see. And that way, if you want to look back, we'll send it out to all of you afterwards as well. So if you didn't see the first one, we also have that recording online. We went through some nice essential things that you guys can do at home, such as proper breathing, belly breathing. We did a lot of hip openers. We did a lot of back mobility stuff. Today, we thought we would emphasize a little bit the shoulders, around the shoulder girdle into the hips, because in our clients, we've been seeing everybody is tight, complaining of numbness, tingling in their fingers. I see a lot, and that often comes from up here. A lot of hip stiffness as well, and some hip pain too. So perfect. You can stand up during this as well. Don't feel like you have to sit and watch. I think I'll start us off. We'll start from the top up a little bit and go through some nice exercises. Feel free, if you have any questions, you can write it in the chat box. You can ask us. Pec stretch. I think everybody should know a pec stretch at this point in their life. What is your pec? It's the muscles right here that attach the front of the shoulder. A lot of us are sitting at a desk, kind of forward, typing forward all the time. Maybe we're on our phones looking forward. A lot of people will have some tightness in through their chest and the rib cage in the front. This, like I kind of alluded to, can put pressure onto the nerves, onto the blood vessels that go down into the arms. So it can cause a lot of numbness, tingling, a lot of issues there. So a lot of clients, I think this is really important for everybody. After you've been working on your desk, after you've been on your phone for a while, when you go to stand up, maybe you're leaving your office, I want you to stop in the door frame. So you'll put both forearms along the sides of the door frame, nice and flat. You'll put them there and then step through the door. So I'll just demonstrate like this so I don't have to move my camera around, but you can try it at home too, so that your arms are going to go back like this as you stretch. When you do a held stretch like this, you want to give it a good hold, like up to a minute hold. You'll feel a pulling through there. You don't want to push too far that it's causing pain. It should cause, you should feel just a mental or a mild stretch through the pecs there. Hold for a minute, go on your day. I would try and make a habit of every time you stand up to leave your office, even if it's a 30-second hold, just stretch those pecs. That will make a big difference in opening up the chest. Do you see a lot of stiffness in your clients too, Marcus, there?
Yeah, all the time, actually. And what I like about that one is it just opens up all the muscles that are always tight, even like the front of the throat and neck. I'll throw in an extra one just on that I like to use just even when I'm like training clients, I'm looking down all day, and if you're looking at monitors or phones, so we could open up even the inner front side of the neck and chest. That's a great way to do it. What I like to do is just place your hands behind your back. So everyone can try this. You interlace your fingers, extend your palms down towards the floor, and then just open up the front of your shoulders, lift up your nose and chest, and just stretch that whole front side of the body. So that gives you the front side view, side view, and then here. And you can open up all those deep throat muscles. It's an extra benefit. So try that doorway stretch, and then this one is great to do right after you have your hands behind your back and lifting your nose up to the sky.
Yeah, you don't even realize how tight the front of your neck can get unless you're stretching it out. Same thing, it's from looking down at our laptops, at our phones all day as well. So I like that one too. And then moving on from there, so that's a nice stretch. What's the opposite of stretching the front is strengthening the back. Absolutely. So if you have a weak back, it's not going to hold your shoulders back for you. If you have a weak back, you're going to let your shoulders round forward as well. So something nice and easy that you can even do at your desk. If you hold the bottom of your desk, so just grasp on, and you can keep your elbows right at your side, and then you'll pull the desk towards you. So hopefully yours is more stable than mine, but you'll pull the desk like this. You want to feel between your shoulder blades, activating those muscles. You don't want to let your shoulder hike up like this as you pull. You want your shoulders to be nice and relaxed down there, pulling from between the shoulder blades. You can hold this for 10 seconds. So we can do an isometric hold, and then you can relax, and repeat that 5 times. So that's a nice, easy way that you can add resistance to actually strengthen in between the shoulder blades. That you'll notice will help upper back pain. It will help neck pain. It will help shoulder pain. It's such an easy, great exercise. If you suffer from headaches, same thing. If your back is weak, all your muscles are forward like this, it's going to pull up into your neck and into your head as well.
Yeah, absolutely. What I like doing is, before clients start training is usually take before photos. So, front back photos. And typically what I find is someone with a shoulder injury, you'll find that their shoulder blades, when you take like a picture of their upper back, one shoulder blade is winged out, possibly almost 2-3 inches further than the other one. That's usually where they're finding they're having pain, stuff like that. So that's actually a great exercise to help. It's a safe way to do it as well, help realign those shoulder blades. Basically what happens is when you're contracting the muscles that are weak or, sleeping, I like to say, and that's why that shoulder is pushed forward. So you see it evident in photos. So this summer, if you're on the beach or by the pool, take a quick back shot, or ask someone to take one of you, and you can reveal kind of what's going on in your musculature in the upper back. So that's a great one.
Yeah, exactly. Ideal, they should be sitting flat, those wings, the chicken wings in your back. Nothing should be poking out. You shouldn't see any bony parts there.
Yeah.
All right. We'll move our way down a little bit. So another place that I'm especially seeing tightness in patients and clients these days is the QL muscle. So the QL muscle is your flank muscle here. So if you notice you're kind of getting a lot of tightness on the side of your low back, it's a tough area to stretch. Not a lot of people know how to kind of twist their body properly to stretch there. One nice, easy one that you might be able to feel is if you bring your legs close to the wall and then your arm against the wall like this, and then just bring your hip towards the wall. So that's doing a side bend there. You don't want to go completely to the side. You want to rotate your body slightly forward. So you're providing a side bend and then forward. So that's really stretching out that flank QL area there. If you don't feel much of a stretch with that exercise, you can reach out to me, let me know. There are some other ones. It can be a tricky area to stretch, but you basically need to do a bit of a side bend. If you want to try it seated as well, you can just put your arm up, bend to the side, and then same thing, you want to rotate that body forward slightly. Again, when you're doing a stretch, you want to give it a good hold. So I would hold that for at least 30 seconds, up to a minute. You should feel the stretch pulling into the low back. And again, if it causes any pain, you don't want to push through the pain. Common sense, listen to your body. If something hurts, don't do it. If something feels like a good stretch, then go ahead with that one as well. A reason that area gets pretty tight in people these days is if you're not sitting with great lumbar support, with great posture while you're sitting at your desk. I find a lot of people get so focused in what they're doing, they tell me, that they're sitting almost like on the edge of their chair or not totally at the back of their chair. Something you can do to help is scoot your bum all the way back so it's hitting the chair, and then you want to use that lumbar support. A lot of people lean forward over the lumbar support. Your back should be resting on the chair as you do your work, and you might find that really reduces the tightness that happens in the low back.
Yeah, absolutely. Those are that's a great tip. I actually find that we move a lot in like this kind of frontal plane every day, so like front and back, but not many people actually move side to side, which is actually healthy. Lateral flexion, side to side is very important, just for our overall lower back health, but actually even like neurological. I've heard like it's really good for your brain as well.
Yeah, for sure. Storm, I see what you said about not feeling the stretch there. It can be common. It's a tough area to stretch, like I said. If you don't have a lot of stiffness there already, just that bend into the wall might not do much for you. And that's a good thing. It might mean that you're not too tight in that area. I can definitely show you another one when I see you next. I can post some more online too. So as we post this video, I'll show a few other QL stretches. It's, like I said, a really common area. And unfortunately, it's one of those ones that's a little bit awkward. You have to find the right spots to stretch, but it feels really good once you do loosen it up.
Sure, I'm going to add to that. So last time I did speak about, low back health and stuff like that. So once you've gone through those stretching, you've created that mobility in the low back. What we want to do is actually, after that, is maybe create some stability so the spine stays safe. So working those similar muscles in that low back, that QL muscle you're speaking about, but also our obliques, is just doing a side plank. So I like to emphasize this because it is so effective for lower back health. And I'll just slowly show you or demonstrate a side plank. So there's two options. I know I discussed these last time, but I love it. So if you're lying on the floor, everyone can give us a try right now. There's two options. What we want to do is we're just going to have our elbow on the floor, knees on the floor. We're going to just lift our hips up and hold this position here. So I'm nice and straight from my head down to my knees, holding for up to 30 seconds. And if that feels, once you get stronger at that, you can extend your legs out. You can either stack them or have one foot in front of the other, lift the hip up, and this is a little bit more of a demanding exercise. Again, try to aim for that 30-second hold. If you can start off just at 10, that's fine. Do it weekly, a couple times a week, and slowly you'll increase your endurance for it. So this is a side plank. We hold for anywhere from 10 to 30 seconds on one side, take a break, and then switch.
That one's so important. Like Markus was saying, a lot of what we're doing is like forward, backward. We don't do a lot in that side plane. So that can be an area of weakness that can really throw your back out. So strengthening your side, those oblique muscles and those QLs is so important to help activate the core, protect the low back too.
Yep, absolutely.
And then speaking of low back, another common area that can tighten up and cause a lot of back pain that's a little bit tricky and hidden is the psoas muscle. Some of you might have heard me talk about it before. I'm big into the psoas. If you want to research it, it's PSOAS with the silent P. So when you're sitting, this muscle is shortened all of the time. It goes from your lumbar spine, so the base of your low back goes through your stomach and it attaches to the front of your hip. So you can picture if you're sitting all the time like this with your leg bent, if that muscle is going from the low back to the front of the hip, it's shortened right now. So to lengthen it, we need to do the opposite. We need to stretch out the front of the hip. If it's shortened and it's too tight, it can pull on your low back. It can cause you a lot of low back pain. So what I recommend to a lot of people who sit at a desk a lot of the time is after you've been sitting for a while, before you start walking, just to make sure that that's not in a contracted state, bring that leg back. So you'll do a bit of a lunge. So you'll bend the front leg. You want to push that hip forward. So you want to feel a stretch through the front of the hip to deepen that a little bit. So I've got my right leg back there and I'll bring the same arm up. So you're stretching the front of this hip and then you just gently bend the side. You can hold a wall or a chair while you're doing this. You should feel a really nice pull through there. Again, it shouldn't be painful. You should feel just a stretch through there. That's important to do before you get going, just to make sure that you've released the muscle. If it continues to be tight, it's not going to let you extend your hip all the way. It can cause hip pain. It can cause bursitis. It can cause low back pain if you've ever heard of all of those. That's important to do. And then the other aspect of that, I talked about stretching the pecs and having to strengthen the back because they go hand in hand. When you're stretching the psoas, the hip flexor, you need to also strengthen the back. So if this is weak in the back by your glute, it's not going to let you relax in the front here. Everything's going to be pulled forward. So step one is stretching that hip flexor, that psoas muscle. And then step two, something you can do, you've probably seen them on your hands and knees before, are the donkey kicks. So you can hold on to your chair. You can bend your leg like this, and you can bring your leg up, down, making sure you're squeezing your cheeks together. That will help to activate the glutes, and those go very hand in hand to help protect the low back and the hips from any stiffness and any pain.
Absolutely. Yeah, let's keep talking about the glutes because you kind of hit the, topic right on with the releasing the psoas muscle. So let's talk about strengthening the glutes or creating them more like stability. So we sit all day, those muscles are kind of quiet. They don't get worked that much, so they don't fire properly. And that's also, it's a supporting joint for our entire upper body. You know, think of like our shoulder and our hips as those supporting levels. You know, if our glutes aren't firing properly, then our low back kind of takes the front of it. So I'm gonna give you guys a couple of my top glute exercises I like to do. You don't necessarily need a band. This is like a really simple band you buy off Amazon, maybe $5 to $10, and you get a set of 3. Really thin, they're stretchy, and what I like to do is applying these around the knees. So our glutes have multiple actions. One is extension of the hip, kind of like how Sarah was just saying, like that. But it also rotates the foot or the toe or the leg outward, and it also what's the third action is abduction. So stepping that leg out away from the body. So what I like to do is you're gonna do a glute bridge. So if you can have a seat on the end of your couch, or you can use a ball. So what I would do is take this, step one leg all the way through, and my other side through. Now I have tension coming from the sides. Hopefully you guys can see that. Now you can do this on the end of your bed or a sofa. And I just slide my upper back onto the edge of the bed on the couch here. My feet are hip width apart. I can even support my upper back with my elbows. And all I'm going to do is I'm going to drop my hips from the floor, applying tension outwards. I'm going to extend up and then just lower back down. So as I drive up, I'm just squeezing my glutes. I'm even tucking my tailbone slightly under. My head is just supported by turning in a bit and then dropping down. You do 15 to 20 repetitions, applying constant tension outwards. It's a great way to get those glutes firing. Have you done those before, Sarah?
I definitely love them. The band adds the extra activation for the side muscles, which is the best. If you're doing glute bridges without it, that's a great exercise. That helps with your side joints, helps activate your glutes, but adding the band and that outward pressure with the knees, it helps to activate all of the surrounding muscles. That one's awesome.
Yeah. So then what we can do next is another great exercise I like doing is a side shuffle or banded kind of side step. So what I've done is I've kept the band around my knees, above my knees actually, and my feet about hip width apart. And I'm just going to take baby steps sideways, stepping, applying tension to that band in both directions. So if you notice, my steps aren't really wide; they're actually more frequent and much shorter. And all we're trying to do is just really wake up those glute med muscles here on the sides. If you don't have
that one looks nice and easy, but you'll be surprised how much you can feel it burn once you do the small shuffle steps.
Absolutely. Another one, if you have a bigger band, this is another option. So what I would do is I would just step on the band. Good thing about using bands is you can dictate how much tension you want to apply. So obviously if I pull this up really tight and then step wide, I'm creating more tension. If you're just starting out, I would suggest give yourself a little bit more and then readjust. So what I'm going to do is I'm going to step on the inside of the band with both feet. I'm just going to add a twist. I'm going to pull up, add a little bit of tension there, and then I'm just going to walk sideways in the exact same thing. So I'm in this nice low athletic stance. Even work my arms and shoulders a bit. Knees are bent. And again, just frequent steps, but they're short. And it's just constant tension. I'm already starting to feel it on both sides. Try that for 30 to 60 seconds. Great way to fire those glutes.
And you might be wondering, I don't know if we fully explained why we're both talking about activating the glutes. If you haven't heard much about that, if you do a lot of sitting, which a lot of us do these days, whenever you're sitting, your glutes are turned off. So they're not firing. They're getting a little bit lazy, I like to say. So when you stand up, you can't expect them all of a sudden to be like, okay, it's my time to work again and to be all activated and strong. So they'll probably still be turned off a little bit, being lazy when you go, start moving, start walking. If your glutes aren't firing, if they're not helping you, you can see how big they are. They're a big group of muscles. They're protecting your back. If they're not working properly, that's why a lot of the muscles in the front, like that psoas, other muscles have to pick up the slack and kind of try and protect your back so that you don't get injured. That can lead to muscle dysfunctions. That can lead to pain, stiffness, and injuries. So I think it's so important to activate those glutes and just make sure that you're feeling them working. I say to people all the time, like, as you're walking, can you feel your glutes kind of go contract, 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 contract? A lot of people say, like, I don't feel anything. I feel it in my hamstrings. You should be feeling that glute kind of squeeze as you bring your leg back. And that's how you know that, okay, they're working, they're turned on right now.
Yeah, definitely. I'm sure you probably have clients that have this problem, pain going down their leg. What would you associate sciatica with glutes? What are your thoughts on that?
Sciatica, I always say, is a symptom. It's not a diagnosis because there are different reasons that you can get it. So it could be caused by a disc in your low back putting pressure on things. It could be a tight muscle. Often it can be a tight glute that's happening too, called piriformis syndrome. There's so much around that area that if something tightens up, it's just putting pressure on that sciatic nerve. You might get that achy feeling down your leg. A lot of people complain of it while they're driving. They can feel it right in the middle of their calf, things like that. Really common these days.
Okay. What's the most common exercise that you give for people that have piriformis syndrome or just?
Piriformis syndrome, a lot of what we've talked about. So a lot of glute activation and making sure that you're stretching the front as well. We went through this stretch last time as well, but I'll just go over it again because it's so great. And I know that you recommend it to a lot of people as well. So you can sit on the edge of your chair at your desk. I like to do this if I'm on my computer for a while answering emails. You'll bring your ankle on top of your opposite knee. You want to keep your back nice and straight. You'll push down a little bit on that knee as long as it's comfortable, and then bring your belly button forward. So you shouldn't be rounding your back at all, just keeping it nice and straight. Right now, I feel a really nice stretch all through those glutes and through that hip. It's a great way to loosen up those glute muscles, especially if you're sitting a lot during the day. What do you think? Do you have another one?
Yeah, I have one that helps release the muscles a little bit. So if you have like a simple foam roller, it's not the best feeling. It's kind of hard to keep a smile when you're doing it. Yeah, the cheapest form of massage therapy. I like to use it for certain uh, areas of the body. So one that would resonate well with the one that you just showed is even foam rolling prior to that. So just sitting on the floor, I have a simple foam roller here. You can find these anywhere at fitness stores or online. So what you do is place the foam roller on the floor, and that outside of that hip muscle that's you were just talking about, that you're stretching. All we're gonna do is we're just gonna lift our hips right up on there, and just nice and easy, kind of relax, digging into that part of the hip. Okay, you'll usually find the trigger point where it's like a sharp pain or discomfort. Just rolling out, spending about 30 seconds to a minute. What you can do is just apply pressure there for about 60 seconds. You'll feel that that pain or that discomfort will just turn into pressure. Once you've gotten comfortable doing that, then what you can do, the next step is cross the leg a little bit higher. That stretches the muscle a little bit more so you get deeper into the tissue. And again, spending anywhere for like 1 to 2 minutes, you roll around, whatever feels good. And then you apply that stretch after. So one of the
Yeah. If
one
you
of the exercises.
If you guys don't have a foam roller at home, it's one of the things I recommend to almost everybody. It's so good for glutes, but it's so good for your upper back. It's good for a lot of different areas in the body. So I totally recommend foam rolling. And it feels awkward if you haven't done it before. You're not graceful on it to start by any means. You can YouTube foam rolling for glutes, foam rolling for hip, and there are a lot of videos that can help you kind of figure it out. And practice makes perfect. And then Marcus, there was a question that I thought maybe you could answer. What happens if you put the band around your ankles instead of your knees? Is it less effective? Do you want to go over what the difference is if you put it up higher or lower?
There isn't much of a difference. Yeah, depending on say somebody has a recent knee injury perhaps, and you're trying to strengthen the glutes for that. It's a little bit safer to keep the band above the knees, so it's not putting any pressure on the joint itself. But ultimately, yeah, it's not that big of a difference really if you have healthy knees. So, yeah, you could try both even, but yeah, depending
And
on
see
what
which one feels more comfortable and more natural for you. If one feels a little bit painful or weird, you can stick to the other one. They're both pretty effective. They both put that resistance that you need.
Exactly, yeah. So if someone has like osteoarthritis in their knees, it's preferable for them to put the band above the knee joint so it doesn't stress it, and you know, if they don't feel pain from the ankles and that's the only option they have, then by all means use it. So you're not using a tremendous amount of strength. It's more like a rehabilitation strength and just trying to wake up those muscles that are inactive.
It's all about waking them up. I agree. If there's any other questions, feel free to ask them now. And then otherwise, I'll just recap a little bit what we went over today. Looks good. And then you can reach out to either of us. I think you all have our contact info if you have any specific questions as well. So we talked a little bit about shoulders and a lot about glutes today. So we started with making sure that you are releasing any tension here. So lots of pec stretching, especially after you've been working on a computer or on your phone for a while. And then if you're stretching the front, you really want to focus on strengthening the back. So holding the bottom of your desk, pulling back, activating those muscles between the shoulder blades, but keeping your shoulders down. We went over stretching for the low back a little bit. Definitely glute bridge on the couch with Markus with the band around your knees. All of that fancy band work, which is not really fancy. It's not hard. Don't be intimidated by a band. They're nice and easy. And it's all about stretching out the front of the hip. So making sure you're not too tight there. And then strengthening and activating those glutes and those hip muscles. What do you think? Did I miss anything?
No, I think you had everything. Basically from the
Perfect.
shoulders down to the hips. Yeah. That was awesome, Sarah.
Yeah.
Perfect.
Well, thank you guys so much for coming. Definitely, if you have any questions at all, reach out to us. We're just trying to help give you nice, simple exercises you can do at home that are honestly very effective. There's a reason that we give exercises. I laugh every time a patient tells me, you know, I actually did that exercise and it actually helped. I'm like, yeah, I know. It
only works if
we
you do
don't
it.
do it just, yeah, exactly. We don't do it just for us. So thank you very much, and we'll let you guys all go. And we will send out a recording of this too if you want to share it with anybody as well.
All right. Thank you very much. Have a great day, everybody.
Thanks, Markus.
See you, Sarah. Take care.
Thank you, Markus. Thank you, Sarah.